See important safety information about InterStim therapy at the end of the video. Only your doctor can determine if this therapy is right for you.
My name is Sarah, and I'm a management consultant, and I'm 28 years old.
Good morning. Good morning, Sarah. You have some missed calls.
It's a lot of work, and I'm very much engaged in my career and where I'm going, and it's just very exciting right now. When I was about 17, I started noticing more frequency and the urgency coming on, and dealt with it through various forms of antibiotics and just different approaches with diet. And then it got worse and worse. I was really embarrassed when I first joined this company that I had this to deal with, and I actually called it bladderitis. I would get into work and attend a meeting and, again, be fine sitting down the minute that you stand up. Kind of embarrassing when you've got clients around and you've got to hightail it to the ladies' room. You just always felt like you had to go. It just was not good. It was horrible. So how I was led up to InterStim was through a physician referral that this was the last hope, basically, that I had. And I went in very skeptical, very reluctant, and very closed to this final idea.
The thing I remember most about Sarah is when she came to see me, she was miserable, first of all. She had tried numerous therapies. Everywhere she went, she was being ruled by her bladder symptoms and was controlling her, was affecting her relationships. She is a professional who travels a lot. It was affecting her work. And when I saw her, she was essentially at the end of her rope. The best thing with Sarah that I remember is when I talked to her about the InterStim, she was so skeptical.
And I was just very skeptical. I didn't believe it was going to work, everything she said. I just really thought she was coming out of nowhere. So I didn't understand why she was so sure that it would work, but given the high percentage rate, I was very open towards the end of our conversation.
InterStim therapy for urinary control treats urinary retention and the symptoms of overactive bladder, including urinary urge incontinence, leakage, and significant symptoms of urgency frequency. It should be considered after you have tried other treatments such as medications and behavioral therapy, and they have not worked or you could not tolerate them. Implanting an InterStim therapy system has risks similar to any surgical procedure, including swelling, bruising, bleeding, and infection. Complications associated with the InterStim therapy neurostimulation system can include pain at the implant sites, new pain, infection, lead, thin wire movement, technical or device problems, undesirable changes in urinary or bowel function, and uncomfortable stimulation, sometimes described as a jolting or shocking feeling. Any of these situations may require additional surgery or cause your symptoms to return. This therapy is not for everyone, especially patients with a urinary blockage. This therapy should not be used for patients who will be exposed to diathermy, deep heat treatment. You must demonstrate an appropriate response to the test stimulation to be a candidate for implant of the neurostimulator, and you must be able to properly operate the neurostimulation system. Not everyone will receive the same results. Patients should always discuss the potential risks and benefits of the therapy with a physician. A prescription is required. For complete safety information about InterStim therapy, call Medtronic at 800-328-0810 or visit Medtronic's website at www.everyday-freedom.com/safety.